So Delta Airlines recently announced that starting in November, unvaccinated employees will be charged an additional $200 per month for health insurance. In a memo, Delta CEO justified the premium hike by pointing to the high cost of COVID hospitalizations, saying, quote, the average hospital stay for COVID-19 has cost Delta $50,000 per person.
In an op-ed, host of KCRW's Left, Right, and Center and insider columnist Josh Barro denounced Delta's decision, calling the choice to tie health insurance costs to health status a, quote, rollback of decades of progress on health policy and a terrible idea. Josh joins us now to discuss. Thank you, Josh, for being with us. Tell us more about this.
Sure. Well, so one of the key ideas behind the Affordable Care Act and by certain laws that led up to the Affordable Care Act, like the HIPAA law that people focus on as a privacy law, but it was also for healthcare portability, was about making sure that people with pre-existing conditions could get health insurance and get it at the same price as people who don't have those conditions. And the reason that we focus on having those rules is otherwise it can become very unaffordable for people to get health insurance if they have previously had cancer or if they have diabetes or they have other pre-existing conditions. Our view is that health insurance is not like other insurance products. It's not like auto insurance or homeowners insurance where we understand, if you live on the ocean, you're going to pay more for hurricane coverage. If you have a swimming pool, you're going to pay more for liability. If you've got speeding tickets, you pay more for auto insurance. Because health insurance, the laws we have are structured around it are supposed to ensure availability to health insurance to as many people as possible. We have fought to delink pricing from health risk. And so you have limited exceptions to that. The Affordable Care Act allows for some increment in pricing for smoking. It's not clear that, by the way, those insurance premium increases for smoking actually affect smoking rates at all. But in general, you're not allowed to price based on that risk. And so I share people's desire to get people to get vaccinated. But there's a lot of other things that you can identify besides COVID-19 vaccines where not getting them increases your risk of filing claims and being costly to your employer or whoever provides your insurance. We could go and look at, are people managing their diabetes well? Are people managing their high blood pressure well? Should people pay a higher premium if they're not taking their blood pressure medication? I don't think it's a great road to go down. I think that there are a lot of things that you can inquire into where people make choices that affect their health status. People say, well, not having a vaccine is a choice, unlike other things. And that's true. But lots of other things are choices that we make in our lives that affect our health and our likelihood of filing health insurance claims. And I think we have good reasons for not wanting that to flow through into the pricing. And so I just don't think I think this is a step down a road that we don't want to go down.
Yeah, and Josh, as you know well, when institutions are trying to push through public opinion to accomplish some objective that the public doesn't want them to accomplish, they'll often try to find, the easiest thing to scapegoat. A recent example being the government combining with Apple to say that they're going to start scanning all of your photos, for child pornography, because who could oppose anything like that? Nobody's supportive of child pornography, and at the same time, this is playing into the widespread sentiment that people have, against the idea that they're going to foot the bill for somebody who's not vaccinated. But are people seeing through this ploy right now? Are people recognizing it as kind of an insurance industry and a corporate play to link together those two aspects and just using this villainized population based on the replies that you're getting to your response?
I'm seeing a real mix of opinion. I think a lot of people really see the link between this and the fight over pre-existing conditions 10 years ago, and going back farther than that. That basically, if healthcare is supposed to be a right, or if healthcare is supposed to be something that the federal government is ensuring that as many people as possible receive health insurance, then adding new things on which you can price just creates more barriers. I mean, certainly you wouldn't want people who work at Delta Airlines to be dropping the health insurance coverage from the company because it's gotten more expensive by $2,400 a year, but that's something that happens when you change the price of health insurance. Some people choose not to carry it. But I think you see there's a lot of moralization about people not getting the vaccine. And, it is a moral question. I don't think it's necessarily improper to moralize about people not getting the vaccine. But I think that this is an area where people say, well, I'm not sympathetic to people who don't get the vaccine. And again, I don't have a ton of sympathy either, but I don't think that we should make decisions about who can get health insurance at what price based on whether we're sympathetic to them. And I think it reflects that, a lot of people's, theoretical commitment to universality of health insurance coverage is in fact quite conditional around, did you make a choice that I disapprove of? But there are a lot of choices that people make that a lot of people disapprove of beyond not getting vaccinated. And I mean, you can just look at how health insurance and disability insurance are priced. You could say, well, should people pay more if they drink a lot? if they engage in high-risk sexual behavior, if they have a job or hobbies that put them at risk for accidents. There's all sorts of other things, choices that people make that can expose them to those risks, some of which are choices that people have moralization around. And so I don't think that health insurance pricing should be a question that's based on moralization, but a lot of people have, for good reasons, strong moral opinions about people who don't get vaccinated.
I think it's a really, really interesting point, and I'm a conservative, but I completely agree with you, Josh. One thing that also comes to mind is this raises a bigger question about how the health insurance industry is going to deal with people who had COVID. If they're going to start seeing that as a pre-existing condition and charging more because of it, because we frankly don't necessarily know the long-term side effects of it. So I think going back to your point of delinking health status from insurance coverage is extremely important.
Right. Well, I mean, and that's in the law now. I mean, if you are buying insurance in the individual market, you can't be charged more based on your pre-existing condition, nor can you be denied coverage based on your pre-existing condition. So as we learn more about long COVID, and there's a lot that we don't know about that yet, some of what's being described as long COVID is sort of vague symptoms that we will see the extent to which that's a truly persistent thing. You also have people who had severe COVID infection, who have very real, ongoing damage to their lungs and that sort of thing. And that is something that's going to follow them through their lives and add to their health coverage costs. And so that's why I think what we did in the Affordable Care Act a decade ago was a good thing to protect those people from the fact that could cause premium increases in the future. So I think that, it does, the fact that we have this new serious disease that in some people has serious long-term effects, that's another reason to be focused on making sure people are not discriminated against because of pre-existing conditions.
It's really interesting to see the flip that's sort of happening in the public discourse when it comes to certain things. I mean, this stance that you're taking is traditionally a more liberal stance, right? Saying, no, everybody should pay the same. It shouldn't matter. And now we're seeing more people on the left saying, no, absolutely, they should pay more if they're not going to be vaccinated. And people on the right saying, no, they shouldn't have to. So, and this is just one example of the many sort of platform flips we're almost seeing, or ideology flips that we're seeing amongst the two sides. It sort of is just depending on who's promoting it. Since we're so tribal, it seems like then people just kind of, okay, well, I guess that's the cause of the day, even though it's totally antithetical to all previous causes that person maybe had previously fought for.
I think it's very similar to the flip that we've seen about the rights of private businesses to decide who's going to do business with them. You've seen a lot of conservatives, a lot of, Republican Governor Ron DeSantis, for example, not only saying that the government will not require proof of vaccination in various contexts, but prohibiting businesses in Florida from trying to require vaccination of their customers, including on cruise ships, which seems like sort of the most obvious place where you really want to make sure everybody's vaccinated because everything goes around like crazy on a cruise ship. And so that's not a small government position. He is interfering in the choices of private businesses. And, my view, I'm a political moderate, but I think that if a business doesn't want to allow people who aren't vaccinated to be its customers, that's the prerogative of the operator of that business. You're seeing a lot more liberals take up that position about the rights of business operators than you are conservatives. And I do think it reflects, again, that tribal, there's an opinion about whether everyone should really be pushed to get these vaccines. And that drives their view not only about public policy, but really about private policies of businesses. And I think it's unfortunate that so many people are showing that they are unprincipled about that. And I think it's good that the federal government has interfered specifically with that cruise ship rule in Florida, which I think was a very bad rule. But I do think it reflects that, conservatives have not been coming at this from a position of individual rights and businesses should be able to do what they want. It's more, who's in our tribe and this business, we don't like what this business is doing and we want to prohibit it.
Same for the left, too, I would say.
Yes.
Both sides.
Yeah.
Well, Josh, thank you so much for joining us. Really appreciate it.
Of course. Thank you for having me.
And we will have more Rising for you right after this.